Youssef Majed, DIO, Designated Institutional Official, and the Chief Academic Officer for South Texas Health System GME Consortium.
Youssef, it's fantastic to see you. I'm so pleased to be invited over here to meet you and find out about the work you do here at South Texas Health System. And I know today's interview specifically is going to be about the General Medical Education Consortium, if I've got that correct. Tell us a little bit more about that program.
Sure. GME is a department that specializes in medical education. Specifically when it comes to hospitals, this is a very important foundation for an academic institution. And right now the GME just started back in 2022, and then with the long vision of establishing residency programs. And we'll dive in a little bit more about what residency programs and what they can do for the community, hospitals, and patient outcome.
Has South Texas Health System ever done anything like this before?
Absolutely. And that's something, thank you for that question. Actually, UHS, the mother company, we have at least, to the top of my head, 30 residency programs across the states. We have some programs as one of the largest across the nations. We have some programs as one of the oldest across the nation. And that gives us resources that are already in place with lots of experience, years and years of experience. So know what we're doing. It's not like copying and paste or learning by trial and error.
And why is this program important specifically for our area, the Rio Grande Valley?
Again, excellent question. So I want to refer back to the diagram here that I have, and that's going to explain, I believe, like one picture better than 1,000 words. And then I'm going to start with the shortage. There is a shortage of physicians in terms of primary care and specialties. And there are some numbers here, just an estimated shortage, 37,800 to 124,000. And this data is in 2021 according to the AAMC. In Texas specifically, and this is what we're concerned about right now, it is currently has a just 204.6 physician per 100,000 people, much lower than the country's average of 24 or 247.5 per 100,000. So you could see the need. And now we're gonna talk about how this really integrate with the GME and what does the GME can do to that. But before I go on, I'm gonna elaborate on the effect of shortage. That shortage affects hospitals. And you can see it's pointing by the arrow here. When the hospitals have shortage, this is going to affect the community, which is the patients, because these patients, obviously they need the services. And then this is where GME comes in. This is the last part we just added right now. What this GME does, it is going to do few things. One, GME residency programs plays a critical role in addressing physician shortage and training high quality physicians. So we're gonna be attracting physicians to the valleys in various specialties based on need. And on top of that, we're going to retain these physicians. And we're gonna be able to bring in new treatments under research for chronic diseases that not readily available to the public when you are an academic institution. And again, in order to be an academic institution, you have to have a solid and strong GME department. GME also, by bringing these people in, they will flourish the underserved community economically. People come here, for example, they need houses, they'll become part of the community, they want to have children, get married, etc. So that contributes economically to the community directly as well. And then enhance patient outcome. Now having more labor, more specialists, more physicians addressing the needs, now you're gonna have better outcome rather than if you have a disease or something where instead of traveling to Houston or even further or across the states, now we're trying to bring everything down here to the valley. And then last but not least, the residency infrastructure. This takes a lot. to establish such a program. I just want to give you one example. Our GME office only, over 7,000 square feet, just offices required for program directors, etc. Residence lounge, conference areas. It takes a lot of commitment on the behalf of the hospital, and it's a big investment. It has to be put up front in order to have that vision fulfilled. And then we do have research and IRB department through our strategic and affiliated partners as well. So what does that mean? It can allow us to bring research about a new drugs, be involved here. We're gonna be, the Valley are going to be involved in drugs that at one point are going to be available for chronic diseases across the world, not only across the nation. A little bit more, the residency program, since we talked about the shortage earlier, not only that flourishes the community as we stated, but also furnishes back the hospital with the physicians needed. And then it goes back also to address the core issue, which is the physician shortage. That is in a nutshell.
So this really is a big investment by your health system in this region.
It's a huge investment. And this is not something that you can think of overnight. Says, oh, I want to be an academic institution. No. It takes a lot of thought. So we do a lot of due diligence. And what we do is, for example, this has been going on for years in terms of study, collecting data, what's needed for the hospital, what's needed for the community, and what programs are going to be beneficial for us. You know, there's so many programs that you could open, that's fine. But what makes it unique here, all our programs are based on the need of the community.
In your opinion, why do you think the US in general, Texas in particular, has such a shortage of physicians?
So number one, I would say is Texas in general, and then us, the Valley specifically, it's a stigma. I came from Chicago, a big city. I've never heard of McAllen before until I met my wife. I met my wife in Chicago, happened that she's in the Valley, and it was the first time in my life come to McAllen. The first time I heard of McAllen probably was in a newspaper back in the President Clinton time, when they mentioned they have the highest of utilizations, etc. This is it. And then whenever we hear about McAllen in general in the news, it is not the most positive. There is always about politics. But again, for me, coming from the Midwest, McAllen, I don't know where's McAllen. An example right now, I talk to people who are friends of mine, says, hey, why don't you come to the Valley? Says, where are you at? The first thing says, where are you at, in reference to Houston or in reference to Dallas? And I say, I'm scared to tell them like 6 hours driving. So I said 1 hour. And later on they learn this is 1 hour by the plane. And I says, no, this is too far. Where are you at? You are on the borders with Mexico. You know, there's a lot of, how would you say it, unfair politics spread online that gave some sort of a stigma. And we're trying to counter that by bringing the real image of the Valley. That no, you know what? It is what you hear on TV and what you see. It has nothing to do with politics. It is totally different, beautiful environment, family oriented, very safe. I go out 2 o'clock in the morning, walk in the park, food, variety. There's a lot to do here.
Saying those comments there, they're like a sequel to something I heard last week. There was a president of a software company who's just installed a lot of software at South Texas College for their simulation hospital. And he didn't know where this place was in Texas, so I guess he flew to San Antonio, and then he had that long drive through the ranch lands, and he said, I'm very dubious. He was saying, I don't know if this will be very good, until he walked into the facility, the Allied Health Center, and he said he went in there and it was state of the art, and he couldn't believe the vibrancy down here, and the people and the enthusiasm and the facility, etc. And he was from Wisconsin, another Midwest area, so speaks exactly to what you're saying, I think.
Yes, and then all it takes me, the positive side, all it takes me is to convince that person one time to come down here, and this is it. we win their heart and mind. The minute they decide to come in for a visit, they look around, like you said, it's like, oh my God, this is heaven. And then their whole mind changes and it says, you know what, I want to be part of this community.
So the decision of our local university, UTRGV, and the UT system to build the medical school, that obviously is got to help. You know, if we're short of physicians, your system is helping here with this program, and that the university is doing the same with the medical school. The issue's finally getting addressed.
Absolutely. So in general, our affiliated university is Texas A&M. Same thing. But these residency programs will be open based on merit. And we definitely want to attract the most talented people, whether from UTRGV, Texas A&M, and various universities. We want to encourage them to come here and then stay with us in the Valley.
So when did that affiliation with A&M start, and how is that going?
It's going very well. We have a very strong relationship with Texas A&M. We're doing right now co-branding. From my understanding, our residents will be having two logos, one Texas A&M and then the other one is South Texas Health System Consortium. We have a very strong and transparent relationship. The expectation is really based on the outcome to the community. So we share that spirit that we both need each other, we got each other's back, and let's make something right for the community. And the beautiful thing about Texas A&M, they have so many resources in terms of IRB department, for example. I have mentioned there on the research. This is needed for some of the research in order to be approved. They have CMEs, continuing medical education for physicians, appointments for physicians. As they advance, they can recognize that physician and give them like an assistant professor, associate professor, etc. And our work with Texas A&M, the beauty thing is we're looking at about what they have in terms of resources. We're gonna look at what we have in terms of resources, bring them all together, put them in one pool, and make them available as a gift of knowledge to whoever seeks education. To me, there is no exclusivity when somebody asks to learn. If someone says, teach me, I feel we are obligated to do that, regardless of where you're from, your background, etc., etc.
And we've always heard, we've read over the years that with when you set up a residency program and it's robust and it works, it's successful, that in general, the doctors, as they're coming out of that program, they tend to stay where they were trained. So that's a fantastic advantage for the Valley to have programs like this. These physicians tend to stay where they were trained. That's what we need. Correct?
Absolutely. And this is what the program shows here. We're addressing the GME by establishing a strong GME program, then we can go ahead and contribute to the shortage. And then yes, when it comes to retainage, and this is a big deal. Yes, you can train high quality physicians, but what is it you're going to do to attract them and make them stay here? So there's a lot of job on us, on neighboring hospitals, and on the community to make sure that our environment is positive. It has a wellness in it. It's a community that people wants to stay. They come in here. Our job is to bring them, and then we need all the help to make them stay as well.
Mm-hmm. Anything specifically you want to add about the GME program?
So I can tell you a little bit more. Right now, there's some stuff because of the legal aspect, I could say, and some I can't tell it becomes available. Congratulations to the GME South Texas Health System Consortium, which just got approved for family medicine. So we are going to be part of ERAS. ERAS is a system that allows students to apply all over the states, from all over the states, to come to the Valley. Our first batch starts in July 1st. It's a lot of work has been done just to get to this point. And then our programs, what makes them unique is we work so hard on the due diligence, on the numbers. We made sure everything on the application is translated in terms of infrastructure and what we are able to offer. So our programs are built to last. It's going to be for generations to come. Again, our first batch for family medicine will be starting July 1st, 2024, which is around the corner. And there's a lot of vibrations going on in the background now with the program directors, the faculty interviewing candidates and trying to bring the best candidates to the Valley. And then 10 residents will start in July, but the complement total is 30. So every year we will increase 10 and 10. So at one point you will have 30 residents in 3 years in the family medicine alone. I think I could tell you a little bit about programs that are in the pipeline.
Mm-hmm.
So we went through site visits. We are anticipating, there's a review committee, they look at everything and then they decide. There's a lot of protocols that we go through an accreditation body. It's called the ACGME. This is the body, very respectful body that decides whether you're eligible and you have all the resources and everything, you have the infrastructure in order for you to train high quality physicians. So family medicine is done. Now we're anticipating the review committee. They meet every 2 to 3 months. Their next meeting is in April. And then we have went through 2 site visits so far for internal medicine and emergency medicine. The minute we get the approval, and I'm very, very hopeful, we will have a 20 residents internal medicine ready to start in July 1st, 2024, and 10 emergency medicine ready to start July 2024. The complement, the total complement for each program, like we said, for family medicine is going to be 30 over 3 years. It's going to be 60 for internal medicine over 3 years, and then 30 for emergency medicine over 3 years. And this is just the beginning.
And so those numbers, those quotas you're factoring in, that's based upon the need here in the Valley?
It's not only the need. The need will still be bigger than that. It is based on.
But in terms of where to specialize.
Exactly. Mm-hmm. So the programs chosen, we have done an analysis for over 6 to 8 months, and it was different teams from different departments coming in, looking at the Valley, what are the needs, and then what are the resources we have. We do have a wishful list, and we have a practical list. So we're going right now with the practical list. It is not only saying, yes, I would love to be to have maybe a neurosurgery residency, but do we have the capability? Is there a need for that? So there's a lot of due diligence happened in the background for 6 to 8 months. We have identified all the shortage needed for the Valley, and we have identified the resources we have at South Texas Health System, plus what is it that we can build realistically in the next 2-3 years to make these programs better. So based on that, we started with these 3 programs, and again, I'm very hopeful they will all start July 1st, 2024. In the pipeline, our vision, we have a vision for 2025 and 2026. If you like, I'll be more than happy to share with you.
If you're making it available to the public, by all means.
Sure. So we're looking at, right now, we're looking for the 2025 to have psychiatry, neurology, general surgery, and transitional year. At transitional, you're talking, when you talk numbers, I mean, we talk about the other numbers, 30, 30, 60. This is for July of this year. This is a huge number. Over 100 physicians will be starting in the next 3 years. They will be here in the Valley. And you can see the impact on the community, financially, economically, and the return back to the hospital in terms of shortage and labor. Now, you're talking about probably neurology. You're talking about maybe about 6 residents per year, and this is 4 years, so 6 times 4. And then you're talking about general surgery. You're talking about same thing, about 4 to 5 residents per year for 5 years. So this is 5 times 5 or 4 times 5. Depends whether you include there's a year called a prelim with it or not. Transitional year, we're looking at 20 residents as well. We're looking at psychiatry, about 4 to 6, which is a huge need here in the valley when it comes to mental health. So we want to be able to address that, and we're heavily working on making a strong program with all the services needed to be able to accept our first batch for these 3-4 residencies I mentioned for 2025. For 2026, our vision to have a combined program of diagnostic and interventional radiology, urology, and OBGYN, pediatric. These are the ones that I can think of on the top of my head. There's a lot to remember. I have that vision written down and it's approved by leadership. We have a great support for it, and we'll see. If we can complete that 100%, that would be great achievement for the whole entire valley, and a great contribution to the state of Texas, and addressing the need, the shortage needed. On the top of that, last piece, we're also looking at about 8 fellowships. This is subspecialties. On the top of that, on the top of the regular residencies, fellowships, it allows physicians not only to graduate from their specialty, but they also subspecialize. For example, you finish internal medicine, that's great. You can do primary care, you can be in the hospital, but what if you want to take one area and specialize in? What if you want to become a cardiologist? I want to focus only on the heart. This is coming. Interventional cardiology, interventional radiology, rheumatology. We don't have many rheumatologists here. So we want to create that pipeline. So later we're thinking about 20 years down the road, that in 10, 15 years, that shortage will be complemented. Endocrinology, and much more. The list goes on and on. We have about 8. That's, yeah.
This sounds groundbreaking. The Valley's never had some of those specialties and subspecialties. We've never had residency programs in those specialties before. So you're doing things that we've never seen here in the Valley, correct?
Correct. So this is not, to me, it's such a pleasure being part of these programs, because it's going to be a legacy. I want the next generations to remember when I first talk about these programs, that there are people. It's a team. It's not one man. It's multiple teams from multiple departments. But I want every single one of us to be recognized as the founders, or the people who put the first finger on this program and says, you know what, we're going to lead this regardless of the challenges.
My last question was simply going to be, is there anyone in the team, in the system, that you want to give thanks to for agreeing with your vision?
Absolutely. So one, first and foremost, UHS in general, the mother company, for agreeing to look at South Texas Health System and says, you know what, there is a big investment that is going to take it from us at the beginning to make this one an academic institution. And then they said, you know what, we're going to do it. I want to thank the leadership of UHS and South Texas Health System specifically for their support. Their support to us has been infinite. I have yet to ask for anything and they say no. All I hear is, tell us what you need. And if I tell you just a little bit of how long and how much it takes to establish one program, I can speak for the next 3 days. I want to have also a special thank to Roberta Reyes, my right hand. She's the administrative director for the GME. She works night and days. Sometimes we call like 10 o'clock at night, there's a lot of things happen. Specifically to Mr. Stark, our VP, and the all C-suites for all being supportive. We meet every now and then, every 2-3 weeks, and then all I hear is really tell us, what is it that you need on our end? And I said, okay, 1, 2, 3, and it says done. To a point like I am super, super impressed. I came from a big area, from Chicago. Everything was jammed. Everything was next to each other, and a lot of resources and a lot of competition. While here I'm seeing everybody's with an open arm. We want to see this happening. So I'm very excited, and also special thank to our strategic partners in Assess Health, Texas A&M, for again give us the opportunity to use the resources that they have, and looking forward a stronger relationship. Program directors, please, one by one, especially Dr. Pareja, congratulations. This is our first program. It will always be our first program. We have Dr. Ilahi will be coming down. We had to import from different states leaders of that for each specialty. For internal medicine, Dr. Rahimi for emergency medicine.
Well, Dr. Majed, thank you so much for this interview. We've learned so much. Have I missed anything out? Is there anything else you'd like to say before we wrap it up?
I want to thank you for the opportunity, and I hope we can follow up to see the progress. One thing is, I always ask myself is, what makes our program unique? What is it different? There are so many other programs in there. And this message is for physicians across the state. I want to tell you that this is the beginning of a great empire that has just started to be built now. Actually started in 2022. A lot of things happen behind the scene. And what you're seeing right now, the fruit came on a golden plate, like for example, the family medicine being approved. This work took about 2 years to see it today. And then I wanna invite you to be part of this GME program today, because this is like a train, it's an opportunity. The nice thing about this program being new, established, first of all, we have the commitment from the UHS and South Texas Health System. 2, you being part of it as a physician is going to give you the opportunity to be part of historical moment. It is something started from scratch, and you will be one of the first people to lead and establish such a programs. There will be great opportunity for you to teach and pass on your knowledge. And I know for physicians, this is a huge gratification in teaching. And then last but not least, you will be able to grow with us, because starting now, no matter where you start, there is only one way, which is up, as we are growing and hiring more and more faculty.
So anyone that's interested, how do they reach you?
We do have a GME department. We'll be able to put it on the screen with your permission, and then the admin here will take the CV, and immediately we have 24. I personally call right away. This is how much we are excited, and then I can share my personal experiences. Again, coming from a big city like Chicago, etc. Why here? Why not? I'll be more than happy to share with you. I do have my wife. I want to thank her so much as well. I left you to the end, Dina, just because you're so special. I want to thank her for the support. My wife is also one of the regional medical directors for the outpatients, and she's part of the GME program. She's an associate program director for the internal medicine. So I want to be able to share with you also our personal experiences. I have 2 kids. They go to school. I want to be able to tell you about the schools here, especially Gonzales, that I am super impressed. What my kids have learned in the past 2 years, me being here. Where do I go? What do we have? Activities, etc. And the neighborhood in general, that is so welcoming.
Well, there's a lot there. Thank you, Dr. Majed. This has been incredibly informative. We've learned so much. And yes, by all means, we will be back again, hopefully every step of the way, to record this and to tell the world about what's happening down here in the Rio Grande Valley. Thank you so much for today's interview.
Thank you for the opportunity. Pleasure.